Why does your body weight matter if you have hypothyroidism? Shouldn't you learn to just be happy with how much you weigh? While I have no problem with how you think about your weight, there's one thing you should know. Your body weight may be the single best measure of thyroid function. And with up to 80% of thyroid patients who struggle with weight gain, this means a lot of thyroid patients do not have their thyroid under control. And it's this reason that I think it's worth spending some time talking about how much you should weigh if you have hypothyroidism. Before we talk about how much you should weigh if you have a thyroid problem, we need to have a quick discussion on your weight and the difference between that and body composition. Your weight, as measured on a scale, represents the sum total of everything that's in your body, including both your muscles and your fat. But when people talk about their weight, what they're really interested in is fat. When a thyroid patient says they want to lose weight, what they really mean is, I want to lose fat. They just happen to associate a drop in their weight on a scale with a drop in the amount of fat on their body. But as we will soon discuss, this isn't always the case. As a percentage of your total body composition, fat makes up a relatively small amount. For instance, the average body fat that a man has will be somewhere between 18 and 23%. The average for a woman, on the other hand, is somewhere between 25 and 30%. Compared to your fat, muscle comprises about 40% of the amount that you weigh, which means it makes a bigger contribution to your weight on a scale than how much fat you have. If we want to have a discussion about weight in thyroid patients, then it must include fat, muscle, and height. It just doesn't make sense to compare the body weight of a woman who is 5'1" to another woman who is 5'11". For this reason, a good starting point for addressing how much you should weigh is your BMI. While yes, it is imperfect, it still takes into account both your height and your weight and spits out a number that is strongly correlated with body fat. So what should your BMI be if you have a thyroid problem? You can first start by calculating your BMI by simply going to the link in the description below and inputting both your height and your weight, and it will give you a number. If the value that it spits out is greater than 25, then that indicates that you are overweight. If that value, on the other hand, is higher than 30, then that indicates you fall into the obese category. The higher your BMI, the more body fat that you will have. It's that simple. If you're like many people, this is probably around the time that you may get depressed or have feelings of self-doubt. Hold that thought for just a minute. While everyone has their own agency and can make decisions which may have led to weight gain in their life, you should know that hypothyroidism is a condition that promotes easy weight gain and is a condition that makes weight loss more difficult. As a result, the BMI for most hypothyroid patients is higher than the average and sits at around 29 to 30 for women. And I didn't have you calculate your BMI to get you depressed. I had you calculate it so you can better understand what it means in regards to thyroid function. If you go back to what I mentioned in the beginning, it will all start to make sense. If your weight is a decent proxy for thyroid function, then patients who have both a thyroid problem and excess weight on their body can start to make assertions about how well their thyroid is functioning. This, of course, does assume that there are no other variables at play, which is often not the case. For instance, you can't blame your high BMI on your thyroid if you're also packing down soft drinks like soda and potato chips. But if you are otherwise eating a healthy diet, then it can give you useful information about how optimized your thyroid is. Let's talk about how to get your BMI into the optimal range if you have a thyroid problem. If you have hypothyroidism, then your goal should be to get your BMI into the range of about 18.5 to 24.9. Understanding where you need to be is easy. Getting there is going to be a little more difficult, but it may not be as hard as you think. If your BMI is primarily elevated because of your low thyroid function, then it is very likely that treating your thyroid will allow for some effortless weight loss. And the best way to get to this point is with the use of thyroid medications. And this is something I see all the time. Once thyroid patients actually optimize their dose of thyroid medication, they start to lose weight without even changing their diet or how much they exercise. And this is because thyroid medications contain active thyroid hormones, some stronger than others, which increase thyroid function and rev up your metabolism. But what if you are one of the many thyroid patients who is already taking thyroid medication but not seeing a drop in their weight? If that's you, then one of two things is true. The first is that you are not taking the right type or dose of thyroid medication, which is quite common by the way. And the second is that you aren't quite as active or as healthy as you ought to be. Both of these problems are solvable though, and both can reduce your BMI. If you're somebody who is already eating healthy and struggling to lose weight, then the solution to your problem is adding both T3 and T2 to your existing thyroid medication routine. If you know that you aren't eating healthy or exercising regularly, then that's the first place to start. A healthy lifestyle is one that will actually naturally improve thyroid function. So changing up your medication after you improve your lifestyle may not even be necessary. You can also lose fat by increasing your muscle mass. Muscle is an incredibly active tissue and requires a ton of energy just to sustain it. And thyroid patients who have more muscle mass will naturally be leaner just because of how much energy it requires to maintain that muscle. But unfortunately, most thyroid patients suffer from a lack of muscle mass because they aren't feeding their muscles the protein that they need. If you are somebody who is not actively consuming 100 grams of protein each and every day, then you are probably hamstringing your metabolism without realizing it. Don't feel bad though, because this is something you can fix by simply changing your diet. And you can do that right away. When looking at measuring thyroid weight loss, should you track your BMI, your body weight, or what about body measurements? Hands down, the worst method for thyroid patients is using a scale to track their weight. The reason for this is that thyroid dysfunction causes thyroid patients to retain fluid. And this retention in fluid can cause wild variations in your weight as measured on a scale. You can still get some value out of your scale by using it the right way. Instead of looking at your daily measurement, take an average measurement over the course of 7 to 14 days. This will give you a more accurate representation of what's happening in your body and will somewhat account for that fluid I mentioned. But if you want to get even more accurate, then I would recommend measuring your BMI and taking body measurements. These two measurements will give you a much better idea of how much fat mass you are losing when trying to lose weight. Why does all of this even matter? There's a big push right now for people to just love their body as it is. And if that's how you want to think about it, go for it. But if you ask me, the reason that I want you to get your weight under control is because of what it means. Having a normal weight means you have better thyroid function. You're less likely to suffer from chronic debilitating medical conditions. You're less likely to get cancer. You're more likely to be happier, and you're more likely to enjoy life. Unfortunately, I think many thyroid patients have just resolved themselves to the fact that they will be overweight forever. But this couldn't be farther from the truth. 99.9% of the time, it is possible for thyroid patients to obtain their ideal body weight. But to get there, you have to avoid some common pitfalls. And if you want to see a list of the most common mistakes that thyroid patients make when trying to lose weight, make sure to check out this video next.